Hey everyone, Dr. Vikas Puri here, President and co-founder of Intelligent Health Group. One common question I get always is, what exercises can I do to make sure I take pressure off my back and get some back pain relief fast? So I am really excited to share that with all of you. It makes it such an important thing to understand. So, speaking of understanding, let's look at our spine first and try to understand the anatomy. My professor in school way back when had told me, and it makes so full sense, your anatomy affects your physiology. Our structure affects our functioning. So understanding what that structure is will help us in creating the right exercise program for you. So, in general, let me first explain the curves of the spine. Okay. So this is your neck area up here. This is your middle back. This is your lower back. Here's your pelvic area, your pelvic girdle. Your lower back has a nice curve to it. It's called a lordosis, okay? And there's 5 bones there in the lower back. Each of them is separated by a disc, and that spacing then allows these nerves, these spinal nerves, to exit and go and plug into different parts of our body. If the curves go off, or for example, if you get a straightening of that spine, you're going to have stress on the structures like your muscles and so forth. If your spine goes into extension, you're going to get pinching of the joints in the back and possibly compression on those nerves as well. So that's going to cause some back pain. So when we're thinking of exercises, especially if it's an acute back pain, where the pain has just begun, or it's inflamed, or it's swollen, or it's a sharp pain, most likely these joints in the back here, okay, and these joints have a nice proper motion to them. This is where the 2 bones connect, creating like a little hinge. That's called a joint. Those areas can get inflamed. The joints get inflamed, and that's why it kind of hurts to extend, and people are kind of locked into a certain position. Okay, so making sure that we understand that any exercises that are going to open up that joint space and take stress off the joints will decrease inflammation and decrease pain. So, factoring in the curvature of the spine, where our joints are, how to decompress those is going to be very, very important. Okay. So, let's talk about the most important exercises here when it comes to opening up our joint spaces. And that really would be a pelvic tilt. A pelvic tilt is where you're going to get that spine, the joints to actually decompress. You're going to take stress off your back, and it's going to give you some relief really, really quickly. So I'm going to demonstrate that for you right now. This is where we lie on our back like so. Okay. We pretend there's a rod going right through our hips with arrows up toward the ceiling. We rotate that pelvis. We rotate those dials, almost imagining that the arrows are facing up towards our head. And what happens is, you'll notice when you do that, that your belly button, your navel, pushes down against the table. And when you do that, you won't have a space between your lower back and the ground. It's best to do these exercises on the ground. So you are able to, again, create the pelvic tilt, remove the space between your lower back and the ground. This will offload the joints. The joints will actually gap a bit, and inflammation will come down. This will also take some stress off those nerves as well. Okay. Now, other variations of lower back exercises for pain specifically, ironically, involve us beginning in the pelvic tilt position. So again, pushing our lower back against the ground, holding that position, and then doing a few different exercises. The one exercise is holding the pelvic tilt and bringing one knee up towards your chest as far as you can go. Again, that's going to help alleviate even more tension on the joints on the one side. You're going to hold for 3 to 5 seconds, come down, and repeat to the other side. Okay. You can have your legs straight extended, or if that hurts, you can bring both knees up in a bent position. So after you do this alternating knee to chest exercise, holding it 3 seconds, repeating it 10 times on both sides, you can continue doing that a few times a day. That will help greatly. The other exercise is where you have the pelvic tilt, you bring your knee toward your chest, and then you cross it over with your opposite arm extended to the other side. You can look away from the side that you're pulling your leg to and get a nice twist into that lower hip and lower back area. You're going to hold it for 5 seconds, 3 to 5 seconds, repeat it 10 times over. And you're going to repeat to the other side as well. Knee to chest, pull across, get a nice stretch into that lower back. Okay. So I would say that the pelvic tilt, the knee to chest, is what I usually recommend all my patients in the beginning when they're in pain. And that's a great starting point. And then later, as pain comes down, we can start introducing others. Now, one other one that is very, very popular, which we can use right now when we're in pain, but also later when we're not in pain so much, but more we're trying to bring flexibility into the spine, is called the child's pose. So I'll demonstrate that as well. That's when you kind of are like this. You bend down. You bring your head down toward the table, and you open up your lower back. I would hold the child's pose position for up to 30 seconds, maybe even up to a minute. You can repeat it a few times over. So doing that exercise a few times a day as well will bring you some great relief. So in closing, remembering anything that's going to stretch that lower back, open up the joint spaces, will help take pressure off your nerves, off your discs, off your joints. It's going to give you that immediate relief. Again, at Intelligent Health Group, we have our 3 steps of care. The first step is all about decreasing tension, decreasing inflammation. That's where these exercises come in really handy. Later, I'll start explaining how we can go into step 2 care, which is where we're really focusing more on flexibility, getting rid of stiffness, and creating better functioning in that spine. And we'll start talking about those maybe from tomorrow. Hope this has been helpful. We'll talk to you soon.